Well, about a week after I was released from the hospital for a gallbladder attack, I came here because they were scheduling an operation, and I came here to see if I could get out of having an operation. I didn't want to lose my gallbladder.
Se ha corregido, se ha realizado procesos de desintoxicación, tratamientos con medicación homeotoxicológica, con vitamina C, altas dosis de vitamina C, y prácticamente pues hemos tenido una recuperación muy satisfactoria.
¿Cuánto tiempo duró el tratamiento?
Bueno, en el tratamiento de Jean hemos tenido alrededor de unos 3 meses.
¿Cada día? ¿Cada 2 días?
No, hemos tenido en ocasiones 2 veces por semana, en ocasiones 3 veces por semana. Está dentro de los límites normales, si podemos revisar allá. ¿Sí? Veamos la circulación sanguínea.
So, when did you see that you were cured, and how did you see it?
Oh, that was very interesting. I had had an ultrasound and a CAT scan done by the hospital, and it showed that the gallstones were very large. They were about 9 millimeters, and the duct coming from the gallbladder is only 4 millimeters, so that caused the pain. I went on a special diet. I had their neurotherapy treatments, acupuncture, energy treatments, well, a lot of things. And when I had an ultrasound done about 2 weeks later, the stones were down to 3 millimeters. And since then I've had an ultrasound and they're down to tiny little grains.
Do you recommend SAMMI Medical?
Oh, I highly recommend them. And I would recommend them in any case or any disease, because they have a broad base of modalities. They're well trained. They go around the world to get continuing education in all of those modalities, and I believe that they can treat / cure so many diseases, if not all of them, because disease is, comes from within as well as without, and that's how they treat it.
Can everybody afford it?
Oh, well, as a matter of fact, the modalities that they're using here, when I lived in Germany for about 5 months, are the same things that I wanted to do there, but I couldn't afford it. I could find it in the US, but couldn't afford it. I come here and I can well afford it on a budget. So yes, everyone can afford it.
How many times cheaper is that here?
I would say it's possibly 80% cheaper.
Are you paid, Gina, to give this testimony?
No, not at all. I'm happy to give it.
Doña la señora Delmira Delgado, paciente de 58 años de edad. Ella tiene una diabetes, es nuestra paciente de aproximadamente 3 meses. Hemos iniciado todo el proceso de tratamiento. En primer lugar, la etapa de desintoxicación. Luego de eso hemos manejado todo lo que es el proceso de estimulación o reactivación vital de su hígado. Porque de alguna manera dentro del enfoque y de la medicina que nosotros manejamos, el órgano o el abuelo o el que controla todo el proceso de su páncreas viene siendo hígado. Tras de estimular la función de hígado, regulando a través de dieta, estamos manejando también lo que es medicina homeopática para estimular la función pancreática. Llevamos prácticamente 3 meses con su glicemia completamente controlada. Cuando vino también tenía comprometido su riñón, los niveles de urea y creatinina estaban sumamente altos. Yo no sé si es que los mismos se pueden apreciar aquí. Ahí hay que tener en monitoreo constante hasta que consigamos estar seguros de una reincorporación de energía vital de su riñón y una reactivación de su páncreas.
Sí, he andado en todas partes, pero nada me hacía. En Macas mismo sabía esto. En algunos doctores me he ido hasta Ambato, venía acá a Cuenca, pero iba lo mismo, no me hacía nada. Y de ahí mi hijo de Estados Unidos me dijo que venga acá y que aquí tal vez haya remedio. Y gracias al Señor, sí.
¿Y cómo se siente usted, aparte de sentirse físicamente, pero psicológicamente, cómo se siente usted desde
sí, medio alegre, medio contenta con mi salud, Antes andaba triste, no tenía ánimo para nada.
¿Y usted recomienda SAMMI MEDICAL?
Sí, señora, yo sí creo en el doctor que sí me cura. Sí me va a curar, porque sí estoy durita.
¿Y usted está pagada para dar este testimonio?
No, doctorita. Yo le estoy diciendo lo que yo siento, doctorita.
You came to SAMMI Medical.
Yes.
What was your illness or your problem?
Well, that's interesting because I had, I think the core issue is digestive problems. And I've had digestive problems, I would say, for the last 3 decades. Since I was a teenager, yeah. So I also had problems with malabsorption, not only breaking down the food, but assimilating the food. So I suppose you would call it malabsorption syndrome. And it was actually a medical doctor in the United States who suggested this place because I didn't even know it existed and I didn't know where to turn. So it was actually an MD from the States who had suggested trying here. And I'm glad that I did come because I did receive a lot of help and a lot of alleviation of my problem. So the root cause was emotional, and so you need to look at this holistically, you know, because it's not just looking and treating the physical. So the neurotherapy treats the emotional and the mental state of the person. And so that was the primary therapy that was used and that worked so well. You know,
Immediately?
Immediately, yes. So having that therapy, that was like, it just like took care of 80% of the problem. And then after that, they gave me some liquid homeopaths. This would be the #1 place I would recommend. Yes.
Are you paid to give this testimony?
No.
You have done, I've heard, cellular therapy here in
Yes.
SAMMI Medical. Can you tell us about this?
Sure. It's something that I believe was developed in Germany, and it comes very highly recommended. It's something that is right in line with the philosophy of SAMMI Medical, as I understand it, about regenerating the sense of vitality in the body at a cellular level, hence the name cellular therapy. I didn't have any side effects whatsoever. It's very affordable compared to what it costs in the United States and in Europe.
Do you recommend SAMMI Medical?
Absolutely, absolutely. Like I said, I know a lot of people like myself really have an aversion to needles. If there's some way you can just close your eyes and go to your happy place for the few seconds that it's a little bit of a pinch, it is so worth it.
Are you paid to give this testimony?
Oh, absolutely not.
Soy el Dr. Williams Pacheco, presidente de SAMMI Medical. Invitamos a todos los residentes, visitantes extranjeros a beneficiarse de las bondades de la clínica.